What's hiding underneath things can be scary. Underwater, under your bed, especially what's under your carpet. Except when you get new carpet from Carpet One Floor and Home. After tearing up your old carpet, they'll vacuum and apply Health Annex antimicrobial to your subfloor, disinfecting and killing mold, mildew, and any remaining general awfulness. Carpet One Floor and Home goes the extra mile to protect you, your family, and your home. Carpet One Floor and Home in Columbia, making your home beautiful, guaranteed.
Good morning and welcome to Radio Friends on this Tuesday, February the 22nd. It's always a pleasure to have you with us. Today we're going to talk about mental health, and I want to introduce you to Megan Steen. Good to have you here, Megan. First time on Radio Friends.
Yes.
Megan is a licensed clinical social worker, and you are vice president of Burrell Behavioral Health Center here.
Yes. Thanks so much for having me this morning, Paul.
It's my pleasure. And we wanted to talk a little bit about mental health. Can you give us a history of how you started caring for people, and how do you decide, or how does someone decide that they need some help?
Sure. Great question. So it's always a good day when I get to start off talking about mental health and, Burrell and the good things that we do. So community mental health was really born of the last legislation that President John F. Kennedy signed in 1963. And so his vision was really to deinstitutionalize individuals and put supports back into communities where individuals could go back into the community and have the community mental health center have all of those wraparound supports that were needed. And so we have a very rich 50-year history that happened between that first legislation and then the next federal legislation that happened in 2014. It actually happened with our own Senator Roy Blunt, that really helped with putting behavioral health and community mental health centers and JFK's original vision for that in a more even playing field with other health entities.
Now, Burrell is designated in a special way as a community health center. How is that different from other mental health facilities?
Great question, and it's a question that we get all the time. And really, it's the scope of the services that we provide. So we provide wraparound services to individuals. And when I think about Burrell and the work that we do, it's really a three-legged stool of community services. And so we have the opportunity to really be innovative in our communities and meet the mental health needs when and where they occur. That looks a lot of different ways. It looks like working with individuals in their homes. It looks like working with youth in the schools. And it really looks like meeting that community need. The next leg of that stool that we think of is outpatient services. And so that's individual therapy, family therapy, group therapy that can happen, and then also medication management. And then the third leg of that stool is our crisis services that happen. So a lot of individuals may not know that we have a free crisis hotline that's available to anyone in our communities who may be in crisis and experiencing a mental health crisis and need someone to connect with.
How do you reach out to somebody who is in need, but who is in denial? And I'm sure you see that a lot.
Sure. Great question. So, it really looks like making individuals aware that there's someone who cares about them and that there are supports and treatment that's available.
And there's nothing to be ashamed of.
And that absolutely, that this is, especially the last year, what has been very exciting, and really more than the last year, but with the pandemic, what we have seen is that individuals are more willing to talk about mental health and the difficulty that this pandemic has brought for mental health.
What is the biggest problem that you see that has come out of this pandemic as far as mental health in the community?
Great. Yeah. I would say that it's the anxiety, some of the depression with being isolated from others. And so that's where we really have tried to make individuals aware, whether they're in treatment with us or in creating programs like our Be Well program that is available to any individual.
Okay. What is the Be Well program?
So our Be Well program was really born during the pandemic, and it was originally born to help support our staff. And it United has gone to the communities to help with that connection and support that individuals were needing. We were hearing that in our communities, that people were socially distanced and they were socially isolated. And so the Burrell Be Well program was really born to let individuals know that while they may be physically distanced, that they didn't have to be isolated.
Mm-hmm. If someone listening to us now or watching is starting to think, something isn't right. It just doesn't feel right inside, but they can't put their finger on it. What do you say?
That there are so many there's no wrong door to care with us. And so there are so many opportunities to either reach out to a crisis hotline, to either their primary care physician. That's one of the most recent expansions that we have had in our central region as well, is a collaboration with primary care to be able to continue creating that no wrong door system.
Well, if they call the crisis hotline, what's going to happen? And when would you recommend they call the crisis hotline?
So what we normally recommend with individuals reaching out for help is that if you're noticing that maybe your sleep is disrupted or your eating patterns are different or your mood has been different and it's been a period of time where it's impacting your life, reach out, and reach out. And when they reach out to the crisis hotline or they come to our Berrywood walk-in services at our Connection Center, they have the opportunity to meet with a mental health professional, talk about what is happening, the symptoms of what's happening, how it's impacting their life, and then talk about the options for care.
Yeah. And I think it's important to realize, all of us, we all have our ups and downs. We have good days and we have bad days. Mm-hmm. And that's normal. That's the normal rhythm of life, right?
Mm-hmm. Yes.
But if your bad days start outnumbering the good days, that's when you need to seek help.
Absolutely, absolutely. We talk a lot about how everyone has mental health. There's a continuum, though. And so that's where our Be Well program, again, that was born of to help maintain in that more prevention model. But also, it's the whole spectrum that we also provide treatment for when you are having more bad days and need that help.
Okay. If people want more information, what's the best thing to do?
So the best thing to do would be go to our website, burrellcenter.com. It has all of the information on the programs and that I talked about today with our Be Well, some other suicide prevention initiatives as well, our crisis hotline, and then all of our locations within Missouri and the hours that we're open and the best way to find us and access.
The website address is?
burrellcenter.com, BURRELL center.com.
Okay. BURRELL center.com. That'll give you all the information you need.
Yes.
Thank you so much, Megan, for coming by and visiting with us today.
Thank you for having me today.
You're welcome. If there is something that you would like to hear or see on our program, just send me an email. That's pepperp@missouri.edu. And when you go out and about, have yourself a nice day and keep a positive thought. Okay? Bye-bye.